Being cautious with hormone therapies, particularly hormone replacement therapy, HRT, used for menopausal symptoms, is an essential aspect of cancer prevention because long-term or inappropriate use of certain hormones can significantly increase the risk of breast, ovarian, and uterine endometrial cancers. These hormones, which include estrogen and progesterone, have powerful effects on cell growth in reproductive tissues, and when used incorrectly or for extended periods, they can create an environment in which hormone-sensitive cancers are more likely to develop or progress. In women who still have a uterus, taking estrogen alone, unopposed estrogen therapy, can cause overgrowth of the uterine lining, endometrial hyperplasia, which greatly increases the risk of endometrial cancer. That's why standard HRT for women with a uterus includes a combination of estrogen and progestin, which helps counterbalance estrogen's stimulating effect on the uterine lining. Even so, studies have shown that long-term combined HRT can increase the risk of breast cancer, especially when used for more than 3 to 5 years. The increased breast cancer risk appears to rise with longer duration and declines gradually once hormone therapy is stopped, but it may remain elevated for a decade or more after discontinuation in some women. Ovarian cancer risk has also been linked, albeit less strongly, to hormone therapy use, especially when used for extended periods. While the absolute increase in ovarian cancer risk is smaller than for breast or uterine cancer, it adds to the overall concern about long-term or unnecessary hormone use. Because of these risks, hormone therapy should not be used casually or indefinitely. The decision to start HRT should always involve a careful discussion between a woman and her healthcare provider about the severity of menopausal symptoms, personal and family history of cancers, cardiovascular risks, and individual preferences. When HRT is appropriate, the goal is to use the lowest effective dose for the shortest duration necessary to relieve symptoms like severe hot flashes or night sweats, balancing quality of life with potential risks. Non-hormonal options for managing menopausal symptoms, including certain antidepressants, lifestyle adjustments, and alternative therapies, should also be considered, particularly for women at high risk of hormone-sensitive cancers. Women who use or have used hormone therapies should stay vigilant with recommended cancer screenings, including regular mammograms and pelvic exams, to catch any potential problems early. Reporting unusual symptoms, such as unexpected vaginal bleeding, persistent pelvic pain, or breast changes, to a healthcare provider promptly is also crucial for early detection. For transgender individuals undergoing gender-affirming hormone therapy, it's equally important to work with experienced healthcare professionals who can tailor treatment to minimize cancer risks while supporting overall health and well-being. By being informed, cautious, and proactive about the use of hormone therapies, you can make empowered choices that help manage menopausal or gender-affirming needs while minimizing the risk of breast, ovarian, and uterine cancers, protecting your long-term health and peace of mind.